Our war has been long. Our casualties have been heartbreaking. But victory is in sight and the end is near. And good morning, everyone. By the grace of God, the COVID-19 vaccines have proven more effective at stopping death and serious illness and more effective at reducing the transmission of the virus than we ever could have expected. So much so that the CDC has now given the green light for vaccinated Americans to return to much of their normal lives. This is great news. It should also be compelling motivation to get vaccinated. For the last 14 months, we have sacrificed together. We have mourned together. We have lit our homes and businesses green to show compassion, and we've rung bells every morning at 10 a.m. Fighting this virus has required the very best of us, knowing our decisions can impact others, knowing we must make decisions to protect even those we've never met, sometimes even those who don't want our help. But with the vaccines, we all now have both the choice and the basic tool to protect ourselves and to greatly reduce any chance we could spread the virus to another person. To date, 1.9 million Kentuckians have made that choice. That means 53% of adults are now protected, including 80% of adults over 65. Because of our progress, on Monday, I announced the state would move to 75% capacity for all restaurants, venues, offices, pools. That 75% on May 28th is now being applied to events both under and over 1,000 people. At that time, our curfew will end and several specific restrictions will be lifted. Since yesterday, Kentuckians as young as 12 have been able to get vaccinated. And the CDC just removed masking guidance for fully vaccinated Americans, with exceptions for places like hospitals, long-term care facilities, airplanes, and others. We have altered our guidance to mirror the CDC's. With these developments, today, I'm announcing that we will return to 100% capacity for all venues and events in exactly 1 month on June 11th. On June 11th, we will also eliminate our mask mandate for all Kentuckians, with the exceptions of places where people are the most vulnerable. On June 11th, just 1 month from today, life will be almost fully back to normal. So, why 1 month? 1 month gives our 12 to 15-year-olds the necessary time to get vaccinated. Remember, the very first opportunity for them to get vaccinated in Kentucky was yesterday. 1 month also gives notice and time to everyone else who has not received their shot of hope. Right now, we have over 500,000 doses ready to go into people's arms. Anyone can schedule an appointment, and everyone should. Let's be clear. A return to full capacity could raise the risk of exposure to those not vaccinated. But the solution is to get your vaccine. We have lost more than 6,600 Kentuckians to COVID. We shouldn't and we don't have to lose any more. Getting vaccinated also allows you to fully and safely participate in Kentucky's workforce as our economy is rebounding. In fact, it is roaring back. Over the past 2 months, we've been recognized as the top economic development state in our region and the top state with under 5 million residents. We've been upgraded by one of the nation's top rating agencies for economic rebound. We posted the best month ever for sales tax. We've seen tens of millions in investments in our downtowns all over Kentucky. And we've broken ground or announced jobs at an incredible pace. In March and April alone, a state economic development board approved over $800 million in planned investments that are expected to bring 1,900 new jobs for Kentucky. That's in just the last 2 months. Year to date, businesses announced plans for 33 projects in Kentucky, comprising nearly $1.5 billion in planned investment and the potential creation of more than 2,700 full-time jobs. That'll be in addition to how we're using the American Rescue Plan Act dollars that through water and sewer upgrades, through bringing broadband to every part of Kentucky, will create another 11,500 jobs. It is so incredibly exciting. And it's only possible because of how we've managed this crisis. As we near the end of this pandemic and the end of these briefings, let me say thank you. Thank you for your kindness. Thank you for your compassion. Thank you for your sacrifice. And thank you for your faith in me. I've sat awake more nights over this past year than I've slept, hoping I've made the right decisions, wondering if I could have done more, and feeling the grief of families that weren't at the bedside to say goodbye to their loved ones. What I can tell you is that this team has done its very best. We've made decisions without regard to politics or even our own future or reputation. In a war where the stakes are life and death, we've recognized that the life of your loved one is the most important thing, and we've tried to make decisions accordingly. My faith tells me that doing the right thing is supposed to be hard, and most of the time, people will attack you for doing it, but it's still the right thing, and your faith pushes and compels you to do it. We still have a little ways to go, but it's clear. We will get through this. We will get through this together. I'm happy today to have Virginia standing actually right over here for the first time in months. And one of the other individuals that we started this journey with and we've relied on so much, let me introduce or reintroduce or bring up Dr. Stephen Stack.
Thank you, Governor Beshear, and good morning, everyone. In Virginia, it's good to see you. Walking into the Capitol this morning is the first time I think all of us have seen each other's faces without masks in a long time. So I think the emotion sort of captures how meaningful this is, and it does sort of feel like there's a new day dawning out there. And as you know, I had emails and texts and phone calls yesterday asking, as soon as the CDC made their announcement, can we do this? Can we do this? What's going to change? And so clearly this was news that we were all waiting for. So I want to echo the governor's sentiments here. I want to enjoy seeing each other's smiling faces again. It's been a long, hard journey for so many. Please maintain our consideration for all those who have lost loved ones over this journey. Be mindful that we have an abundance and a blessing here in our country and in the Commonwealth. We have access to vaccines that are life-saving and life-protecting, and there are so many countries around the world who do not have that same benefit. And even as we celebrate today a new dawn and a return to some sense of normalcy, there are countries around the world who are still very much in the midst of a horrible struggle, unlike one that humanity has seen in a very, very long time. So thank you to all of Kentucky. Thank you for the privilege to come into your households, to come into your lives, to play a role advising the governor and advising you. I started going out into grocery stores again recently, and 3 out of 3 times I got stopped just walking down the aisles by people who recognized me and said thank you. And please know how much that means to all of us who serve you. It has been difficult. I do get emotional from time to time. I'll pull it together here, but it does get difficult because, as I think you know, this has been hard. People have suffered. People have seen their lives overturned and disrupted. But I want to continue to remind you all, the things that have been the most inspiring have been just how many times people have come together to support each other, the times people have been kind and caring and considerate for each other. And I want to ask you all to please keep that up. We are very near the finish line, but the way we stay safe is for all of us to get vaccinated. And when we're out in public, folks, I'm still going to have a role giving you advice from time to time. Please, 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 if people wear a mask, it's for their own safety. It's to keep themselves or their loved ones or someone else that's important in their life safe, because they may be more vulnerable and may, for whatever reason, still be at elevated risk from this terrible disease. I hope you'll all take the opportunity to get vaccinated. I hope you'll all still be kind and considerate and caring for each other as people still try to protect themselves and adjust to where we are now. It's going to take some time for people to get used to, again, returning to what we used to do before all of this started. I'm also going to ask for you please to be mindful that the journey changes a bit now. Before, when the vulnerable couldn't protect themselves, before when large numbers of people could have been subjected to serious harm, hospitalization, intensive care in a hospital, or even death, we had to take steps to protect people when there was no other way to protect them. Now individuals have an opportunity and they have a choice to get vaccinated, and they have a choice to determine what settings they go into or not, and a choice to wear a mask when they need to protect themselves. So now, folks, the calculus shifts, and you've got to be thoughtful and be mindful and protect yourselves and take advantage of the things that help us to reduce our risk. And as we wrap up my remarks here for now, I want to remind you all, we've got to get on with our lives. It's appropriate for us to get on with our lives. Nothing in life is risk-free. I'm an emergency physician, and I saw that for an entire career in the ER. Life is always full of risk, but we have tools now that allow us to make that risk reasonable, to make that risk something that is tolerable to accept in daily life. And I please just continue to encourage you all to take the opportunity to get vaccinated now that children 12 to 15 and adolescents can get vaccinated, please. Vaccine is abundant. There are plenty of opportunities. Go to the website, use Vaccine Finder to find a place to get yourselves and your children and adolescents vaccinated, so that when we enter summertime for sports practices and enter the fall school year, we can all be back to normal as fully as possible. So again, thank you very much for the privilege to serve. Thank you, Governor. Thank you, Secretary Friedlander. And I'm probably not gone from your lives quite yet, but it'll be a lot less frequent. So let's enjoy our return to normalcy. Thank you.
Finally, just as a housekeeping matter, we'll be doing COVID updates on Mondays up through that final week of that ends June 11th. Right now, our plan is for that week to be the last week we provide these live updates unless the situation changes. So with that, we have 12 different journalists on with a question. We'll start with Phil Pendleton from WKYT.
Thank you, Governor. I was just curious, with all of these restrictions ending, and obviously this is still a virtual news conference, are you going to be opening room 110 back up to the press corps soon as well?
Well, you know, the very first things we wanted to make sure we did is fully understand the CDC's new guidance is to get information out to people who've been wanting to be able to do more, and then we'll work on getting press back into the briefings. We'll certainly be able to, in the near future, go back to having y'all smiling faces here as well. Sarah Ladd from the Courier-Journal.
Yes, thank you. In the month or so remaining on the mask mandate, the state's mask mandate, where does this leave businesses? Can they lift the mask requirements in line with the CDC guidance for people on their properties, or do they still have to require masks until June 11th? Thank you.
So that's a good question. First, there are businesses out there that look like they are going to continue to require masks. One large grocery chain. Please respect that. Again, that's their business. If they want to require wearing masks, they can, and we should respect that. There's also going to be people out there that want to continue to wear a mask for a number of reasons. We should also respect that. With regards to businesses out there under the CDC guidance, fully vaccinated individuals don't need to be masked in most business settings, with the exceptions the CDC put out. Until June 11th, the unvaccinated individuals need to go get vaccinated, but per the CDC guidance would need to continue to mask. Melissa Patrick, Kentucky Health News.
Hi, Governor. So other than giving 12 to 15-year-olds time to get vaccinated, do you have any other reasoning for not going ahead and lifting capacity on all businesses at this time? Can you just kind of talk about that a little bit?
We walked through that. The first reason is for 12, 13, 14, and 15-year-olds. to have that month to get fully vaccinated. But the other is this is a major step. And so people out there who aren't vaccinated now have the choice and the time to get fully vaccinated before we hit that 100% capacity. Obviously, there's going to be more contact, there's going to be less space. And if you are unvaccinated, there may be a greater likelihood that you could be exposed to COVID once we hit that June 11th date. So right now, you can get online, you can sign up, you can get vaccinated. And for whatever reasons that you haven't to date, you can still get vaccinated in time. This has given everyone that runway and that time to make sure they can get their vaccine before that 100% capacity date. Stu Johnson, WEKU.
Yes, thank you, Governor, and good morning. Is there the possibility when the mask coming off for a lot of people that the vaccinated, or I should say the unvaccinated, will feel like it's a stigma to be wearing a mask and feel pressure to not wear the mask? That's kind of a convoluted question, I think. But do you follow where I'm going there?
I do. Where we are right now is the CDC says if you're vaccinated, you're protected enough to where you don't need a mask. If you're unvaccinated, you are not. And so the best medical advice in the world would say, if you want to take the mask off and be safe, get vaccinated. If you are unwilling to get vaccinated, you really need to wear the mask to protect yourself from what is a pretty lethal virus. Karen Czar, WUKY.
Thank you, Governor, and thank you to everyone on the team. Thank you for all your work over the last several months. The CDC guidelines also talked about social distancing. Should we continue to maintain that if you're vaccinated until that June 11th target date? And have you ever been more excited to get rid of a logo in your life, which is the Mask Up Kentucky logo? Thank you.
This is a pretty great day. I mean, I never thought, and we're not done. We're not fully there yet, but being this close to the end, I think back in some of the early projections and the numbers of people we thought that we'd lose. I remember sitting down and us creating a map that if our hospitals were overrun, where we could send people and where our state parks were and where hotels were that we could rent out and negotiating those. I remember the days of the entire governor's office being on the phone of somebody's cousin of somebody's uncle saying that they could get us PPE. I remember having to stand up here and say, even if you're sick, if you're young enough, please don't go in and get a test because there aren't enough. That was hard. So I am thrilled at how effective these vaccines are. I believe that they are a gift from God that we should all get to be able to put all this behind us. And now can somebody remind me what the actual question was? No, that was the second question. Karen snuck two in. Oh, CDC social distance. It would be wise, especially up until June 11th, to keep as much distance as you can. And then after it, remembering that COVID is still out there and we can look at where things are and where cases go, but keeping some distance between yourself and other people while this is still going on is just a smart idea. Tom Latek, Kentucky Today.
Good morning, Governor. Thank you very much. Happy Friday to you. My question is, and this is kind of from the business owner and operator perspective, how are they going to be able to tell the difference between the vaccinated and the unvaccinated when people don't wear masks? Is they going to have to rely on the honor system?
They can post the rule. They can make announcements. They don't need to be checking for anybody's cards. And then on June 11th, unless they are one of a very specific number of locations, they won't have to worry about it at all. Lawrence Smith, WDRB.
Yes, Governor. Some Republicans have been asking you to set a date, and now you've done that. walk us through the decision to set the date as opposed to continuing the $2.5 million goal that you originally set?
So for the last, I think it's 9 press conferences, we've said that as more people get vaccinated, as we get more information from the CDC, as our cases continue to stay lower, that we would lessen and lessen restrictions as we go. But the CDC's news yesterday is just a game changer. I mean, it's huge, and we all feel it. And so that certainly changes things. It goes along with new projections on where we'll be in July. Goes along with now 12 to 15-year-olds getting the opportunity to get vaccinated. If we'd moved as fast as some other people had said, we'd have everybody in middle and half a high school that this virus is impacting that wouldn't even have the chance to get vaccinated and to get protected. So this decision is based solely on following the science. I've tuned out political noise, sadly, that started really early on and kept going totally beyond politics and all this. That doesn't mean everybody is, but I certainly am. Ryan Van Velzer, WFPL.
Thank you, Governor. Now, where did my question go? Here it is. Anyway, so I was talking with a medical director this morning and asking them a similar question about whether or not they'll continue to wear a mask going to the grocery store and other similar settings. I'm not sure when the last time you went to a grocery store was, but I'd be curious in the future, do you intend to wear a mask when you go to that or other public settings, even after June 11th?
You know, I found myself pulling out my mask even in the last day or two, and I still have it on me. For more crowded settings, I will probably wear a mask. Going into a grocery store where I shop, I think they where I shop when I go, they just announced that they're going to ask Kentuckians and others to continue wearing a mask, and I'm gonna do that. If I choose to go to a very large packed event, which I'm still going to think about very carefully for a while, knowing the risk, I may mitigate that risk by wearing a mask. Certainly, if I'm in the medical field for a number of reasons, I would very strongly consider wearing a mask. We do need to, and I think the question also raises, we do need to be willing to give each other space and grace. We got folks walking around the Capitol today. Today's the first day that it hadn't been required if you're fully vaccinated, who are still wearing theirs. And we understand that. It's very hard to move from the world yesterday before the announcement to the world today. But yes, there are going to be situations where I'm going to continue to do it. And that's going to be based on personal assessment of the risk. Scott Brown, WKDZ Radio.
Thank you, Governor. With June 11th now set as the reopening date, what specific economic priorities will you look to achieving as governor as the state puts COVID-19 in the rearview mirror? Thank you.
Well, the exciting thing is what we are already seeing. You know, last month being the top month in our history, not just since the beginning of the pandemic for sales tax, show our economy is hot and it's growing. So many out there hiring. More economic development interest and opportunities than I can remember. Just the last 2 months alone, over $800 million of announced new investments. Our goal is going to be to sustain and grow it. And that's going to require easing people back into the workforce. It's going to require recruiting new people to Kentucky to join our workforce. We certainly have to look at emerging industries and industries of the future, like agri-tech, like aerospace, like advanced manufacturing and electrification, knowing that if we are going to truly be a leader in the post-COVID economy, we need more than just new jobs. We need the new jobs of the future. So those are going to be good paying jobs. Those are going to be jobs that offer good benefits. And they're also going to be jobs that we know are going to be around in 30 or 40 years. So our recovery has to be sustainable. And my goal is that it takes us to a level that we never thought was possible. And I believe that's our true opportunity out there. The last goal I'd say is that opportunity has to extend to everyone. Every part of our state, every part of our cities. I know whether it's Western or Eastern Kentucky, oftentimes the feel and the reality is that there aren't as many new jobs or jobs announcements in those regions. I look forward to changing that. Parts of our bigger cities, Louisville and Lexington, the feel and the reality that we're not building enough wealth in certain communities. We got to look to change that. And we're going to have more opportunity to do that now than ever before. The last 14 months have been hard on all of us. The next 14 months have a chance to be something really special. Carolina Buszczyk from WLEX.
Good morning, Governor. For the next month, different things are being asked of Kentuckians who are vaccinated and those who are not vaccinated. What is the best way for people to navigate during this time to ensure that they're doing the proper thing, that they're wearing masks in the appropriate settings? Should they just have a mask with them at all times? Is that the best way to go about this?
Great question. Everybody should continue to carry a mask with them because there may be circumstances where businesses or venues still require them. You'd want to have it on you. There may be times where you suddenly don't feel as comfortable, and that mask absolutely adds additional protection. And then we should follow the CDC's guidance, which is if you are not vaccinated yet, you ought to be wearing a mask indoors. Outdoors, unless you're really packed in, the CDC said you're okay. Can we pull up the list? Do we have the slide on the areas the CDC says you still need to wear a mask? Let's pull that up. Okay, so these are areas where everybody in Kentucky still needs to wear a mask. Public transportation, healthcare settings, long-term care settings, school until the end of the year, correctional facilities, homeless shelters, and then there's the advice for immunocompromised individuals. On schools, this is pretty important. Just about everybody in school, is 18 and below, but a large portion, 15 to that 12 range. They have not had the opportunity to get vaccinated, meaning the vast majority of the population inside any school, even when you look at the statistics of 17 to 18, aren't vaccinated and won't be fully vaccinated until the end of school. We'll be able to remove this piece in the summer. Most likely it won't apply to summer school, but with just a couple weeks left and with at least 2 school systems that have had COVID flare-ups, we got to get through the end of the year. And we always promised that we would prioritize the education of our kids and getting and keeping them back in person. Joe Ragusa from Spectrum News.
Hi, Governor. So I want to ask kind of about the future of COVID, because obviously it's not gone. It's still affecting us. And I know vaccinations are a key part of mitigating all of this. But, how are we going to deal with outbreaks wherever they occur, either in schools or any other place, as we kind of move on and move away from restrictions? And what criteria are you going to use, to possibly consider new restrictions if, a variant comes up or something, that makes the situation much worse than what we're seeing now?
Well, we certainly hope that we don't see a situation where we see another spike in the country or across the state. Any additional actions we take would be nuanced because of the number of people vaccinated now and how protected they are. It would be a very different calculus and a very surgical approach compared to when there weren't vaccines at all, or there weren't tests at all, or there wasn't enough PPE. So, the landscape, the battlefield has changed in so many different ways as we've gone through. It's an entirely new day that is really exciting. And the first part of that question, did I get all of it? How will we deal with outbreaks? We will deal with it in the same way with one change. Outbreaks are still about identifying, contact tracing, and quarantining, except those fully vaccinated, except in exceptional situations, would not be asked to quarantine. So you take that same bubble once you have an outbreak and you after you've done the contact tracing, those who have been vaccinated most likely will not be asked to quarantine based on the protection of that vaccine. Those who are unvaccinated will need to because they have a significant likelihood that they may have contracted the virus. So that'll be the major shift. And finally, James Pilcher from Local 12.
Good morning, Governor. Thanks for taking my question. As you probably saw, Ohio Governor Mike DeWine made a similar announcement, but he's lifting that state's restrictions on June 2nd. Can you walk us through why you decided to push it out another week? And does this lift all of the state's health orders for the entire, except for nursing homes like Governor DeWine did, or will there still be some restrictions in place starting June 11th?
So there will be some restrictions in terms of masking requirements at the places the CDC, again, says that you have to wear them. The federal state of emergency is still in effect, so ours will be, because it also allows things like workers' comp for first responders who are out because of COVID or quarantined because of COVID. It allows for certain folks that have recently retired to be able to come back in case of a shortage in those critical positions, allows certain things on prescription drugs, making it easier to get them if you are maybe immunocompromised, haven't been able to get a vaccine for certain reasons yet. So there are a lot of those kind of nuts and bolts things that have made it easier for us to have the necessary folks to fight back against COVID. That will remain in place. I don't know Governor DeWine's calculus. I'll say ours is, I believe that kids 12 to 15 ought to have the chance to be fully vaccinated right before we hit 100%. I also think it's the right thing to do to provide every Kentuckian notice with enough time to get fully vaccinated of when we're hitting 100%. So that's what we're doing today. I think that treats everyone in a fair way, and again says, go out, get vaccinated. June 11th is going to be a very new and a very special day. Make sure you're protected before that date. Virginia, it's great to have you back here in room 110. We even got Kenneth back the other day, but of course you won't see him. I'll just yell at him. Special press conference. Better news than we've had in a while. We're not fully done, but we are really, really close. We're going to get through this. We've almost made it through this. We're going to finish it together. Thanks.